placebo. They were assessed at week 6, and then after that they were re-randomized into the maintenance group. And let me show you the results. So this is a patients in clinical response aversion rate. So at 6 weeks already, dividing patients exposed to anti-TNF versus
called tailored therapy. So you have to be like a tailor. The suit that fit you will not fit somebody else. So we have to individualize your therapy. And by individualizing your therapy, it depends on the behavior of your disease and your symptoms and with the response. So
and completely destroy structure. So the type B, these are the ones that are potentially neoplastic. So this is where you'll find low-grade dysplasia, you might have fine-grade dysplasia, high-grade dysplasia, and colorectal cancer. And the higher you get towards 4 or 5, the higher the risk of colon cancer. So imaging, when this was done initially in the sacroiliac joints,
but also a specific finding in the spine might be very well correlating with IBD. And this was, I show here, erosive changes. Why do I point this out so much? Because we know that erosions are not typically seen in spondyloarthritis. So this leads me to the conclusion that
most of people you go in, you see they're on 50 milligram hydrocortisone TID, sometimes even 100 milligram hydrocortisone TID, and this is a super mega dose. And those are the people who are getting complication after the surgery, specifically infection. So we should be discouraging people. If you can't measure ACTH, please do ACTH. If you have,
if there is imaging positivity, or if there is platelet cell positivity. This is pretty easy, I believe, and to me it doesn't really make too much sense to say we take everything and if something is positive, send the patient to a rheumatologist. What we have now developed, and I think that makes sense clinically also, is a pretty...
For mild patients, for severe cases, we sometimes systemic non-steroidal anti-inflammatory and topical steroids. And again, most of these patients will have probably already getting treatment for the disease using the anti-TNF antibodies, so this can also be used as a form of.
And this is the same patient 3 weeks after treatment with hydrocortisone, and you can see the improvement. So bioimaging knowledge again can be seen by both, but more common as ulcerative colitis. Presentation usually they start with a hospital or nodule, and then they go to biomarkers.
Internists and other medical specialists will try to be very strict with their criteria about the quality before they have biomarkers. And so our criteria for depression is not very strict. In order to diagnose major depressive disorder, so clinical depression, you have to have 5 of 9 features.
كلمة كبيرة مضادة للالتهاب اللاستيرويدية اللي قد تسمى انسيد، اللي هي مجموعة البروفين، الفولتارين، كتافلام، اولفن، هذه المسكنات. طبعا هاي المسكنات جدا يعني فعالة وتنفع خاصة لآلام المفاصل، لكن مشكلتنا في داء الأمعاء الالتهابي احنا ما نحبها كدكتور جهاز هضمي، لأن في بعض الناس
لما يقوم من النوم هو أسوأ وقت عنده، الصباح هو أسوأ شيء، في بوسة قاعد تطول له ساعة، مع الحركة يتحسن. إذا أخذ بعض الأدوية اللي تخفف الألم مثل البروكسين أو الكتافلام أو البروفين يحس في تحسن، إذا كان عنده ديسك ما يتحسن، فهذه من ناحية كلينيكية.
ما في أحد بالدنيا ما حس بحزن، أنا طبيب نفسي وأنا أحزن وايد، لأني إنسان. الواحد إذا ما حزن ما راح يفهم شنو معنى السعادة، لأن ما عندك مقارنة أصلاً. فالحزن هو شعور إنساني طبيعي، لكن مرض الاكتئاب هو حزن بالإضافة إلى أعراض ثانية، ممكن يكون عند الواحد على الأقل 5 أعراض ثانية.